Hi guys, and welcome back to the Rundown podcast with me, Sanjvi Okidi. As you can see, we are on visuals now as well as still on audio as well. So welcome to the show. Happy New Year. Well, I'm not sure how much is a Happy New Year considering Boris just made an announcement saying we're going back into lockdown, and that's lockdown number 3 for us here in the UK. We're about to get into it. COVID, vaccine, our government, is it a hoax? Is it real? Is it fake? Anti-maskers, what is going on? Well, let's start with COVID itself. Let's start with COVID-19. There are people out here that believe that this is fake, that this is not real. I believe, actually, it's not even about believe, it's real. COVID is real. COVID can kill. It's facts. That's actual facts is there. COVID is real, okay? I don't see how, actually, I can see how people would think this, but I'll be explaining that in just a minute. First, let's go back to January 2020, last year. This time last year, I personally believe that I caught the virus back then. I'd just been traveling back from Uganda. I'd landed back mid-January, and halfway through, I had a connecting flight as well, by the way, in Dubai. Halfway through this time, I started to develop symptoms. I was not well. Me and my family were sick. Literally like a week later, we were like proper sick, like shivers, sweats, colds, and I put it down to being a flu and the fact that we had travelled from a hot country to a cold country. I don't know if that makes sense, but that's just logic for me. And I put that down to that's how I got sick, and that's how the family got sick, and travelling as well. I didn't think about it being a possibility of COVID at the time at all. And I put that down to the fact that our government wasn't really talking about it, and our media was rarely reporting on the COVID that was happening in Wuhan, China. It was by the time of mid-January, late January, the end of January, China already had 540 cases of COVID officially recorded, by the way. That's official, which means that there could be more. That just wasn't official. And about 17 deaths. And I remember hearing or seeing about this in the news, but it wasn't mainstream news, but I remember reading about it. But it wasn't like it was, this is a global thing. Like this is a China thing. We're just reporting what's happening over there, and that was it. So I didn't take much thought of me being sick, my sister's being sick. I didn't think it was COVID at all. But I believe that was the first mistake that this government had made, because by the time you got to 22nd of January, you've got the Public Health England already. They announced that we gone from a very low risk to a low risk, which shows an increase of risk, right? And the World Health Organization had already declared this a global health emergency by the end of January. So clearly this was a problem. Clearly this was an issue that was arising, and people could predict that this was going to increase. But I mean, I'm under the impression that every government has a stringency plan in place to deal with any national issue that arises. So in case there was a terrorist attack, I believe our government has a plan in place to either prevent it or how to deal with it post-attack. If there was a financial crisis, our government have a plan to deal with it, or to prevent it, or how to deal with it during the recession itself. If there was a natural disaster, our government has a stringency plan in place to deal with. We're more likely to have a flood, on where to put stops in place and how to deal with the flood after. I can't imagine that we don't have a plan in place for a pandemic, bearing in mind Public Health England just made that announcement, and the WHO, World Health Organization, just declared it a global health emergency by the end of Jan. And we didn't really much know about it How many of us knew about COVID in January? I think I had friends who told me like they possibly had it in December of 2019. So how did our government continue from February? We had our first couple cases come in February. People would come off this Diamond Princess cruise ship, let into the country with the COVID. And Boris is out here shaking hands. They then announced a lockdown on March 23rd. And we enter a very serious lockdown. And literally the next day, Matt Hancock, the health secretary, announces that they're going to build this Nightingale hospital that has a capacity of 4,000, needs volunteers of up to 250,000. They spent about £220 million on these hospitals, which are up and down the country. I think there's about 4, don't quote me, but I think there's about 4 of them. And this is where I think it got a bit, that's where the scaremongering comes in. Because when I heard about Nightingale Hospital, in my head I was like, oh my God, we just went into lockdown and they've already started building for, capacity of 4,000 in London, let alone up in the north. This is going to be deep. That we're anticipating for a lot of bad things to happen with this COVID. You don't just spend £220 million on hospitals for no reason. So this is going to be serious. It's going to be that deep. It opens, the XL1 opens on 3rd of April, and I believe they treated only less than 20 patients. A couple of weeks later, it was shut down, or put on standby, as they say. It was shut down. Now that, for me, when it gets shut down, now you're portraying the notion that it's not actually that deep, and we don't actually need this hospital because the NHS could handle it, or our hospitals are already equipped to handle it, or whatever. It's starting to come across like the COVID is easing, so we don't need this hospital anymore. This is just my thought process. In May, we had the highest death toll in Europe. The UK had the highest death toll across Europe in May. That's literally just after they shut down this Nightingale hospital. So how do we have the highest death toll? On top of that, Black and Asian people are dying at a disproportionate rate due to racism, in which I explained in episode 2 in the whole Why Are We Clapping? Go and listen to it there. But when you put all these factors together, and then we come out of lockdown in June, July, we come out of lockdown. Social distancing, they're drawing white circles in the grass so you can social distance 2 meters. Wear your mask, wear your gloves, blah, blah, blah. And you're starting to say, oh, we're getting better, it's okay. But then we go back into lockdown 2, which was the shit version. Again, it didn't even do much, to be very honest. It was only in it for about a month. I mean, we know what happened. It's confusion. It is complete confusion. 1 minute we're here, 1 minute there, open the door, close the door. I am so confused. Confusion at its highest. And then we wonder why, well, that's what I think anyway, that some people have come to their own conclusions, that they think that this is fake or that COVID isn't real. And I definitely believe it's the way that it's been handled. I don't think a virus like this should be handled by politicians. But here we are, and now there's a rollout of this vaccine. A vaccine that took less than a year to make, when a vaccine usually takes 10 to 15 years to develop because it's a very complex process. And we now have one, actually not just one, we have 9 different vaccines for COVID that was rolled out less than a year, available now. The country here has some, and across the world as well. That was billions of pounds and dollars spent on. I think this is another reason why people may not want to take this vaccine. because the trust has been broken through this yo-yo roller coaster ride that we took in 2020. Shake people's hands, lockdown, Nightingale Hospital, not that deep, shut it down, 2-meter distancing, blah 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 blah, here we are. See what I'm saying? And then now you're saying, okay, it's that deep, we need a vaccine to stop this. You don't really give us much trust in the beginning. Me personally, forget all about that, I am not taking a vaccine because it's not developed enough for me. Less than a year doesn't even equate to 10 to 15 years of a vaccine. People have had seizures, people have had allergic reactions. Just because you show people taking it on TV, me personally does not mean that I will be taking it or that I think that it's safe. The amount of people that has probably been tested on is not equivalent to the amount of people in this world, the different amount of people in this world, different kinds of people in this world. You know what I'm saying? Again, I'm not here to spread my personal agenda. If you want to take the vaccine, if you are ready to take the vaccine, go ahead and take it. If you want to do that, that's no problem. I personally do not want to. I don't believe that is ready yet, and it's not for me at this moment or ever. Me personally, again, it's up to you guys if you want to do it. I'm not here to spread a personal agenda. I'm here to just talk on my own podcast about why I think that the peopledoms have lost trust in our government, in this tier system, and now we are in lockdown again. Tier 5 was just announced today, just after Boris said this morning that schools could be open and that it was absolutely safe for kids to go back to school. But then at 8 p.m. you announced that we're back into lockdown again. To be very honest, I didn't hear the same conviction. Not the same, and it needed to be tougher conviction actually from Boris to be like, we have to get this down. There's a whole new variant. I didn't hear nothing about our borders being closed. There's a bag of people, there's a lot of people in Dubai, there's a lot of people in Ghana right now, there's a lot of people around the world just coming in and out the country. Instagram, snap. What's going on there? I didn't hear nothing about that. I didn't hear anything really that made it any different from tier 4. Yes, schools have been closed, and yes, you can't, mix households and all this stuff, and it's more or less the same as it was in the beginning of the lockdown. I mean, to me, it's almost like you use the same poster, same hand gestures, Boris, and expecting this to be tougher. I didn't hear the toughness that is needed, because the thing is, the reality is, whether people think it's fake, whether people think it's real, whether people think it's a hoax or whatever, the politicians are in charge, and we need to get these numbers down of COVID, which are very real. So a lockdown is needed. We all know we need a lockdown. We all know we need tougher restrictions. We all know we need to stay at home. And I think we're all prepared for a solid 2-month lockdown. Should be even 3, but a solid lockdown where everyone's at home. That's it. Get these numbers down straight away. Not we're gonna check up on again on February, and because the way he was talking, the aim is to get everyone vaccinated by mid-Feb. Everyone in this 4 group of people, that was key workers, social workers, above 70-year-olds, and I can't remember the other 2 groups, but yes. And it's okay, that's great and good for the aim and for your goal, but don't be opening up the country and putting us back in tier 3 just because this 4 group was vaccinated. It needs to be solid, it needs to stay in place, and I think at this point we just all want a normal 2021. We don't want a repeat of 2020 at all. I don't want a repeat of 2020. We already wasted a year I don't want to say wasted, because I am still here, we're still good, I'm still healthy, but that year wasn't great for everyone. We need a real happy new year. How about that? A real one. And I think the only way that we're gonna get a hot girl summer or a carnival or a proper Christmas by the end of next year is by getting this bit locked in now, in order for us to start to get on with our lives again properly. That's just what I think anyway. I mean, I've heard people say things like, you know, they're more scared of being punched in the face than COVID because that's more real to them. Whether it's real or not, like I just said, we need to have this restrictions, we need to have this lockdown, we need to get these numbers down in order to move on with our lives. And that's the rundown, and that's it. That's what we need to do. Thank you for listening to the Rundown podcast with me, Sanjavi Okidi. Until next time, it is available on all streaming platforms, all audio platforms, and now also YouTube, so make sure you comment, like and subscribe. And yes, I'll be back with another video. Thank you for watching.